I'm Krista Schulte. I'm a nurse practitioner at the Outpatient Wound Center here at CMH. I wanted to talk to you a little bit today about a diabetic foot ulcer. Diabetes is a concern that a lot of people have. It can lead to foot complications. And when I say diabetic foot ulcer, I mean this is a wound. It's an open sore, usually somewhere on your foot. You're at increased risk for a diabetic foot ulcer if you have a history of smoking, high blood pressure, high cholesterol, if your blood sugars in general run higher than what they should. All of these things could lead to some damage to your arteries and to your nerves. This in turn can lead to some neuropathy of the feet. That's where you don't have normal sensation. You may have lack of feeling, or you may have an abnormal tingling sensation. So when that happens over time, we can get some pressure points on the foot that may initially start out as a callus. And then over time, that callus can lead to a buildup of pressure underneath and eventually to an ulcer. So to prevent those things, it is important to monitor your feet for that, making sure you're wearing shoes that help take pressure off of that area on your foot. When people come to us and we are treating the diabetic foot ulcer, we will work on making sure the callus is trimmed down and kept at minimum, working on getting correct shoes, appropriate wound care, definitely working on getting your blood sugars under control. We have other specialized treatments we can do to heal a diabetic foot ulcer that involves casting. That sometimes is very helpful as well. Some risk factors that you can work on to avoid complications would be getting your blood sugars down under control, exercising for 30 minutes a day, taking care of your feet in general, and preventing the ulcers to begin with. If you are a smoker, that is another big thing we really push people to cut back, preferably quit altogether, because this can definitely worsen the problems with the blood vessels in your legs. So a lot of people with diabetes do say they battle dry skin and often ask what type of moisturizer to use. We typically recommend moisturizers that don't have any perfumes in them. Something very gentle on the skin, such as Eucerin, Aquaphor, Lubriderm. Gold Bond also makes a very good diabetic lotion. And if you don't have any of those, even just Vaseline would work as a good moisturizer. But keeping your skin moisturized does help prevent skin breakdown and ulcers and cracks in the feet. When I talk about inspecting your feet, that's looking at the bottom of your foot, using a mirror if you can't see the bottom of your foot. Looking in between the toes is especially important. If you're unable to see or use a mirror, have a family member or friend take a look at your foot periodically to look for anything you might have missed. Another thing I wanted to mention, sometimes those people with diabetes or even without diabetes may get some changes in their feet where they may have hammer toes or claw toes, and that may be where a portion of the toe looks like it's bent downwards and can create pressure on the tip of the toes, or sometimes a bunion can cause the toes to shift. So those sorts of things can cause pressure in certain areas. So monitor those, and if you start to have signs of redness or thickening of the skin, that would be another thing to talk to your doctor. If you see a podiatrist, talk with a podiatrist, because there are special shoes and different things we can do to help take pressure off those areas and prevent it from getting to an issue of having a sore there.